Okay, it looks like we're live on Facebook. My name is Mandy, and I am with Project Recovery Iowa, formerly known as COVID Recovery Iowa. We're trying to encompass a little bit more of the tornadoes that happened in Winterset, and we've always been here for those impacted by the derecho. We're here for that extra emotional support, free counseling support that's often needed in the event of a disaster. So I have with me today Miranda from the Allen Child Protection Center, and it's also Child Abuse Prevention Month. So this is good timing to have Miranda on here. She's going to tell us a little bit about the services they offer, some trainings they have, a little bit about the expertise of all their staff. So I don't know what you want to start with. Maybe how about services? What kind of services do you offer at the Child Protection Center, Miranda?
Yeah, so at the Allen Child Protection Center, we provide forensic interviews, medical evaluations, family advocacy services, and mental health support for children and dependent adults and their families. Really, when there are concerns that a child may have been abused or a witness to a crime, and same for dependent adults. So we work collaboratively through a multidisciplinary team approach with law enforcement, the Department of Human Services, other partners to provide those types of services. We also have what's called our Family Resiliency Program, and that is more of a assessment and intervention service for children who are typically ages 0 to 5 who are suspected to have been exposed to substances. So that runs a little bit different appointment process than what we call our traditional CPC appointments, but again, it's a service line that we're really excited to be able to offer in our service area as well.
Is that a newer service, or have you always done that?
We haven't always done that. It's a little bit newer. We're going into I think 2-ish years now of having that, and we're definitely starting to see as more people are aware of that service, more referrals coming in for those types of appointments.
Okay, so let me make sure I get it right. So 0 to
I don't know if it's my sound, but I can't. All of a sudden, I can't hear you, Mandy.
I can hear you.
There you. Okay, no, you're back.
Oh, good. I can hear you. So 0 to 5, an assessment process, an evaluation type process for kids that you suspect may have been impacted by substance use or abuse during.
Typically prenatally, but also even if there was early on environmental exposure, support for those types of concerns as well.
Okay, evaluation and support.
Yeah.
Got it. Okay. So I'm guessing for that type of service, they could call you directly. But
yes.
Okay. And then if somebody suspected child abuse of a child or a dependent adult, you mentioned, how does that referral process work?
Yep. So because we're part of a multidisciplinary team, we need law enforcement and or the Department of Human Services to already be involved. Our team, we're all mandatory reporters. And again, because of that multidisciplinary team approach, we really want those agencies who are ultimately going to be investigating and assessing these concerns to be part of the process from the start. So there's no anybody playing catch up. We're all there hearing the same information at the same time. And so that's why referrals do need to come through a law enforcement agency or a child protection or a dependent adult worker with the Department of Human Services to really get things started. So when we have people call, wanting to set up appointments, but those agencies aren't involved yet, we do let them know that, really the first step is getting those agencies contacted.
Got it. Sounds good. So tell us about the clinical expertise of your staff.
Yeah, so all of our staff have what we kind of consider that next level of training to really be a support for families going through these types of situations and these types of concerns. So all our medical providers attend a specialized medical academies to be really more prepared to deal with and assess these types of situations. Our mental health therapists are all trained in treatment models proven to reduce symptoms of trauma. Our forensic interviewers all attend a specialized specialized forensic interviewer training, and then are required to do continuing education specific to forensic interviewing to make sure that we're staying up to date on those skills. Our family advocates all become certified advocates. All our nurses become sexual assault nurse examiners who are also trained in the pediatric side of that world. So again, that when we need to respond to these situations, we're as prepared as we can be to do so.
And we're glad you are, for sure. So what kind of trainings do you offer to the general public? Or I'm a licensed mental health counselor, so do you offer training specific for other people in the community?
Yes. So our big one or most popular one, I would say, is our minimal facts interviewing. And that really is set up more for professionals who may be receiving disclosures of abuse from children. So they're working with them directly or indirectly, really just to help them understand the process, what questions to ask versus what questions to stay away from, different things like that. And so that's a 2.5-hour training. We offer that typically by request. On April 25th, we are doing a workshop series of all our trainings, including minimal facts interviewing. So if someone was interested in signing up for that, they could call our center or email me. I'm not sure exactly how to get my email to everybody, but we could figure that out. But again, calling the center would be fine to get signed up for that. Otherwise, we do overview presentations, sort of similar to this, but where we kind of walk through our services, typically go over some data from the previous year that often we're doing more for community groups so that we can, again, just kind of help our community understand what we do.
So if you appreciate this information and you want to hear more about the process, then maybe you could sign up for one of those trainings, and we can put Miranda's email or other contact information in the chat as soon as we're done with this Facebook Live, so people can contact you.
Great.
What else do we need to talk about? How about what you mentioned, something about data, and then I'm also kind of wondering if there's a common question, like if somebody in the last couple of years, even maybe to be more pandemic specific, a common question that you've gotten as far as people calling in.
Yeah, so in the last year, we had over 600 patients. Every year, I would say, I believe for sure for the last 5, our numbers, just continue to go up. That could be for a lot of different reasons, including that people are just learning more and understanding more about reporting abuse when it's being disclosed and things like that. But we do, continue to see our numbers increase. A common question, I would say, I think, again, kind of what we talked about already, I think sometimes people assume that they can call and schedule a forensic interview or a medical evaluation for their child without getting the Department of Human Services or law enforcement involved. So we do still have to do a lot of education around really what our role is and how the process works. Just to keep everybody kind of on the same page about what this looks like and why we do the process the way that we do. So that tends to be a common question from community members when they are aware of a concern or have a concern.
We can certainly put the DHS number in the chat. If you were to start with law enforcement first, is there a specific number to call with law enforcement?
So law enforcement gets involved where a concern occurred. So let's say something happens out of town, we'll use Cedar Falls, for example. So if a family's living in Cedar Falls, but something happens when they go out of town to visit other family or friends, it would be law enforcement in the town that they went and visited, not the Cedar Falls Police Department. So certainly I would imagine, the Cedar Falls Police Department or your local law enforcement agency would support a family and working that through. That's my experience, that they're always very helpful with that. But ultimately, it will be investigated where it is believed the concern occurred.
Very good to know. What are you doing for Child Abuse Prevention Month? Have you got some activities?
Yeah, so we're very lucky that we have some amazing community partners who appreciate the work that we're doing, as well as wanting to support Child Abuse Prevention Month, because ultimately that's where we want to get, is to child abuse prevention. Our team would all love to be out of a job someday. So a couple things that are coming up. Icon Donuts and Sweetery, they have been doing a Blue Donut Day with us for the last couple of years, but this year they're going to do a Blue Donut Week for us. So people can order half dozen and dozens of donuts now through, I think, the 23rd maybe, or 24th possibly, for that last week of April, to be picked up and hopefully enjoy lots of donuts. And so then a portion of those sales from those blue donuts for Child Abuse Prevention Month, which blue is the color for child abuse prevention, will come back to our center to support the families who we serve. Additionally, the Applebee's in Waterloo is going to have a Together We Care event on Tuesday, April 19th from 4 to 8. There's a special menu that when people order from that special menu, portion of the sales from those menu items will go back to the center.
So that's making me think about your location out of Waterloo there. So what if are there, how much do you cover as far as geographic area, and where are other options as far as services like yours?
Yeah, definitely. So our center here in Waterloo serves 27 counties in the state. So we sort of have the northeast section. We also have a satellite location, or a secondary location in Mason City. So we do send a team there. It kind of depends, but usually a couple times a month to provide the same types of services at that location. And then there are 5 other centers in the state that serve the other counties of Iowa. So we're all accredited through the National Children's Alliance out of Washington, D.C. We're all part of the same Iowa chapter. So the easiest way to kind of check on those locations is to go to the Iowa chapter of Children's Advocacy Center's website. It has a list of all the centers and where we're located. We all otherwise provide most of the, if not all of the same services, but because we work so collaboratively together, though, we definitely have situations where we have kids not in our service area come to our center for one reason or another, and vice versa. So, but generally, we expect most of our patients to come from the 27 counties in Northeast Iowa that we serve.
Very good. I'll take this moment just to say, if anybody that's watching if anyone has any questions or comments, go ahead and put those in there, and I can monitor the chat there and pass those on to Miranda. She can either answer them here in the live, or we'll get back to you on them. But feel free to put some questions in there if you have any. What else? I think we've gone through the list. But what do you mainly want people to know?
I think the main message is that when a child does disclose a concern, to take that seriously. There are certainly situations that do come up where there's a misunderstanding of some kind, but rather than making that decision or that determination on our own, if a child is reporting something that sounds like it's abuse or that it could be abuse, I really encourage people to go ahead and make that report. And again, if it's found to be a misunderstanding, okay, but if there's a possibility abuse is happening, we want those agencies to get involved so they can investigate and assess that accordingly. And if a child needs to be kept safe, then hopefully be able to do so. So I think sometimes when kids disclose, that can feel kind of overwhelming for a lot of different reasons, and rightfully so. But to not report could mean that abuse, may continue. And so I encourage that bravery to make those calls and let the process be the process that we work to have in place. We try to create a space that's really non-traumatic and safe for kids, that if they do have things to share, that they can do that with us if they're ready to do so. And again, that those agencies who are really investigating and assessing, then have the information they need to move forward with what they need to do next.
Thank you for doing what you do. If anybody is in need of free counseling support, you can reach out to projectrecoveryiowa.org and submit a request for assistance there. And we'll put Miranda's contact information in the comments, but if you want to give a shout out with your email address right now, you sure can. And then we'll follow it up with putting it in the chat.
Yep, so it's miranda.cracky@unitypoint.org, and you can hopefully see my name on the screen. That's how it's spelled. Again, that gets right to me, so then I can answer any questions, or if you'd like to be signed up for anything with that workshop series we have on the 25th, just let me know.
And Annette, we do have one comment, and it's Annette, and she says, great information, ladies. So thank you for your time, Miranda, and
thank you.
have a good rest of your day.
You too. Thanks, everybody. Thanks.